Hello, my name is Maria Moore, and in this presentation I will discuss diabetes awareness and prevention. I will talk about the two types of diabetes and their risk factors. We will focus on pre-diabetes and the prevention of full-blown diabetes, the effects of diabetes, and we will plan a nursing intervention which will include education and goals for patients. So what is diabetes? Simply put, diabetes is a condition where food is not properly utilized for energy. This causes a rise of glucose levels in the bloodstream. Normal blood glucose levels are between 70 and 110 milligrams per deciliter. There are two types of diabetes, type 1 and type 2. Both types cause a rise in blood glucose levels. Type 1 diabetes was previously known as juvenile onset diabetes. This is an autoimmune disease where the body attacks the insulin-producing cells in the pancreas. It is unknown what causes this autoimmune response, so there is no prevention for type 1 diabetes. The pancreas is no longer making insulin, so there is only treatment for this condition. Type 2 diabetes was previously known as adult onset diabetes, but adolescents and children are now being diagnosed with this condition. Type 2 diabetes usually begins with insulin resistance, a condition linked to excess weight in which your body cells do not use insulin properly. Type 2 diabetes can be prevented or delayed, but it is important to recognize the early symptoms of the disease and take preventative measures. There are several risk factors for developing type 2 diabetes. Age greater than 45, being overweight, a BMI or body mass index greater than 25, family medical history, having a parent or sibling that's diagnosed with diabetes, and ethnicity. Some races are at greater risk for developing type 2 diabetes. Some symptoms of diabetes include, in the early stages, increased thirst, increased hunger, and increased urination, especially at night, and fatigue. More advanced symptoms of diabetes include blurred vision, numbness or tingling of the hands and or feet, and sores that do not heal. We have already identified that a normal fasting blood glucose is between 70 and 110 milligrams per deciliter. Prediabetes is defined as a blood glucose level that is between 100 and 125 milligrams per deciliter. This is the range that is greater than normal, but not high enough to actually diagnose diabetes. Another standard blood test that may be done is the hemoglobin A1C. This indicates the average blood glucose level over a 12-week period of time. Results between 5.7 and 6.4 indicate prediabetes. In 2010, a staggering 79 million Americans aged 20 years or over had prediabetes. Prediabetes is a condition that can be reversed through relatively simple measures. Increased level of activity. Just 30 minutes of moderate exercise 5 days a week is very useful. Moderate weight loss. 5 to 10% loss of body weight. For a 200-pound person, there is a weight loss of between 10 and 20 pounds. The effects of diabetes can be quite devastating. Diabetes is the leading cause of new cases of blindness. It is the leading cause of non-traumatic limb amputation and renal disease. Diabetes is a major cause of heart disease and stroke. The costs to treat these conditions run in the hundreds of billions of dollars every year. With this in mind, it just makes sense that we would want to prevent the progression of this disease when possible. The nursing intervention I have chosen for people with prediabetes is to educate them in the importance of exercise in reducing or maintaining a healthy weight. Patients will be able to explain what a healthy BMI is and how to calculate their own. They will also understand that moderate exercise for 30 minutes a day, 5 days a week, is an important factor. Patients with prediabetes will voice an understanding that activity makes their cells more sensitive to insulin and will therefore work more efficiently. And losing 5 to 10% of body weight can significantly lower blood glucose levels and hemoglobin A1C levels. The 2 patient goals set for this nursing intervention are: the patient will exercise for 30 minutes a day, 5 days a week, and will be able to voice the benefits of exercise in weight loss. And the patient will accomplish a BMI in the healthy range between 18.5 and 24.9, and this can be accomplished by exercising regularly and following a calorie-controlled diet. In conclusion, diabetes is a potentially preventable disease, and by recognizing the early signs of diabetes or prediabetes, this condition can be prevented. By following a calorie-controlled diet and exercising regularly to maintain a healthy weight, diabetes can be avoided. Thank you for listening to my presentation.